And it's Ask the Expert. Our expert today is Dr. Abhishek Gupta, who is a surgeon at Bronson General Surgery right here in Battle Creek. Dr. Gupta, it's very nice to have you with us today. Good morning.
Good morning. Thank you so much for having me.
We're going to talk gallbladders a little bit, and I've been around a long time, and I got to confess, I still don't know where it is or what it does for sure.
Well, your gallbladder actually it's a small little organ and lives right under your liver, which is kind of in the right upper part of your abdomen there. And normally it just holds bile, which is it's some greenish liquid. Sometimes if you might throw up really hard. Sometimes you might notice it comes up and it's very bitter tasting. Your liver makes that and it helps you digest the fats and stuff in your food. And your gallbladder just stores the extra bile, and it works when you eat things that have grease or fat in them and helps you digest your food.
When you say it's small, kind of give me something to go by. About the size of what?
Let's say normally it's quite small. It's maybe about 3-4 inches long. Sometimes they can be a little smaller. Sometimes they get really big. If people have them infected or they might be causing some problems, they can get pretty large. They might get up to 6 inches in size sometimes. But normally it's I'd say about 3 inches long or so.
Well, while we may not know a lot about gallbladders, I think most of us know a little something about gallstones. Uh, when you have one, you know it. What are the signs that you're having problems with a gallbladder, and what exactly are these gallstones?
That's a good question. So, gallstones, a lot of people have them their whole life. They may never know about it, so we leave it alone. But sometimes it can cause some problems. Gallstones are sometimes they can be very small and fine, like gravel. Sometimes they're very large, like a golf ball. And Sometimes it's made of cholesterol deposits, so sometimes it's diet related. Sometimes it's just people develop them. And When they're really small, sometimes they can fall out of the gallbladder and drain down the pipes that drain your gallbladder into your intestines. And Sometimes they can get stuck in there, and that causes pain, just like a kidney stone might cause pain as it's getting stuck. You might have pain for a little while, and then it goes away as that stone passes. Sometimes those stones can just plug up the drainage part of your gallbladder and not let things drain out of there like normal, and your gallbladder can just get blown up like a balloon, and that can cause pain sometimes. So there's different things that can make it hurt. Sometimes it's certain foods. A lot of times we notice it's greasy, fatty, fried, heavy things, dairy sometimes, and sometimes it's anything people eat. It might give them a lot of pain, kind of cramping in the right upper part of their belly, and that pain sometimes it spreads to their back. Sometimes it goes around the side. Sometimes they can get nausea and vomiting as well at the same time.
What's the process to diagnose a gallbladder issue?
So first, we talk to patients about kind of what they're feeling, what they're noticing, things that might make it worse or better, the timing of the pain, and then we might look into it. We might do some imaging. Sometimes people have CAT scans that have been done previously. We can look at that, but usually one of the best tests we have is just a simple ultrasound that can give us a lot of information about the gallbladder and what may or may not be going on there. There's other more invasive tests that sometimes we use to check your gallbladder function, but oftentimes we start with just an ultrasound, and often that's enough to give us enough information to go forward.
And how do you know when it's time to remove a gallbladder?
Well, we go by how people feel. Sometimes, more often, it's a problem that's been sort of brewing for quite some time, and maybe it was a small sort of nagging problem or discomfort, and every once in a while they might get it. But then maybe this just keeps going on for months or even years. And that's more commonly what we see is people have been having this problem for a long time, and they just gradually, it bothers them so much that they say, we got to do something about it. Sometimes people come in on the other end of the spectrum, and people can get very sick from a gallbladder problem or an infection, and sometimes people are in the hospital and they have to have emergency surgery for it as well. So it kind of varies, but more often than not, it's something that's probably been going on for a little while, and they just didn't notice it, or they just kind of ignored it or pushed it aside, and sometimes it just gradually gets worse.
We're talking with Dr. Abhishek Gupta of Bronson General Surgery. So, you can take a gallbladder out and people can live a fairly normal life then?
Yeah, that's right. It's a fairly common operation that we do in general surgery, and it is an organ that you're removing. Your body does adjust well, though. Some small percentage of people may notice some change in what they're able to tolerate afterwards. Sometimes greasy things may give them some, diarrhea type symptoms or affect them in that way. But most of the time, your body sort of regulates itself and adjusts over the next, couple of weeks or months after the surgery, and they're back up and running like normal.
Now, I'm going to go out on a limb here and bet that the surgical options have improved since my grandma had hers out in 1967. Uh,
Yeah, we have made a few changes in that area, and most of the time, I would say 95, 97% of the time, we're able to do this with the scopes. Personally, I use the robot as much as possible, and that's a type of laparoscopic surgery as well. I do it that way because it enables me to see additional things that I wouldn't be able to otherwise, and also patients tend to have less pain afterwards. We usually are able to do it through 4 small incisions. This is an outpatient surgery where people get a date and a time for the operation, and we do it, and then they go home afterwards. And that you're able to also do it with the regular laparoscope. Doing it with the robot, I have the advantage of also using a special dye during the surgery to make sure that we can identify the important parts and structures that are around the gallbladder, and also we make sure that things are clipped and there's no leaks that we can see during the operation. This is all while everybody's asleep. It's general anesthesia, so you don't remember anything, don't feel anything during the surgery. And small percentage of the time, you have to have the operation like your grandmother had, and it's an incision over the gallbladder, just under the ribs. And sometimes we do it that way because people might have really bad scar tissue from prior surgery, or the disease is so bad we can't see the important structures that we need to see. But we just do it the safest way possible. But the vast majority of the time, we're able to do it with the laparoscope.
Fascinating subject. I can tell from your answer that you're very well equipped there at Bronson General Surgery. If we think we might need to see somebody about this, what should we do?
Sure. Our office is located, it's attached to the hospital, and it's located on the second floor, directly above the outpatient pharmacy. They can go to the website. It's bronsonhealth.com, and you can hit the magnifying glass and just search my last name, G-U-P like Paul, T like Tom, A. Our office number is 269-245-8310, and they can call and make an appointment anytime.
Dr. Gupta, thanks for joining us today.
Hey, thank you so much, Tim, for your time.